So this study, the KEYNOTE-158, the vulvar cohort cancer, proves that immunotherapy is a valid treatment option for patients with advanced vulvar cancer. This is an unmet need to search for treatments for this group of patients. Usually this disease is quite rare and belongs or is evident in elderly patients and lacking clinical trials, randomized clinical trials. So this study proved that clinical trial in vulvar cancer cohort is feasible, although demanding, and treatment patients may have benefit from these studies and from new treatment options. Interestingly, we couldn't identify the exact phenotype of patient that will be mostly responsive to PD-1 inhibitors, to pembrolizumab. So both patients with PD-L1 positive and PD-L1 negative tumors responded to treatment. And of course, it just called us or sent us to search more deeply to look for correlative studies, to look for for predicting factors to response to immunotherapy. I think that one of the important points of this study is that clinical trials in vulvar cancer patients are feasible. Usually this is a disease which is an unmet need. I mean, elderly patients, non-controlled randomized studies, and poorly represented in the other clinical trials of gynecological cancers. And we could enroll these patients, although it needed time, it needed effort to enroll these patients, but we have a valid, one of the largest clinical trials in vulvar cancer. So it's a disease with no proven efficacy of systemic treatment. We need to search more deeply, and we have patients who still need an answer to their disease. And as I said before, this study proved this is feasible to conduct clinical trial in this group of patients.